the middle of introducing you and I get all confused, but I think you all know Ellen, and she is our policy officer, and we're really lucky to have her back from maternity leave. I think you've been back already for a little while, but it feels good to have you back on Thursdays. And although these webinars were not really clear on when we were going to be running them, I think we've come to a clear schedule, and it's going to be the first Thursday of every month. And so probably right at this noon time. So that said, we do have 2 people are in the waiting room.
Yeah, just
okay. That said, we have a special webinar next Thursday with Russell Johnstone from DESE. So that one will be actually at 11 again. So sorry for the confusion around the schedule, but for Ellen and I, for state and federal updates, including COVID related, it'll be the first Thursday of every month at 12. And today we have Charlie also joining us, which we're really lucky for because he's been following the state elections. And he'll give us a nice update on that as well, which is really important. So this is what we're going to try to get through today. I was feeling hopeful last night, so I put a picture of my guys and me in front of the flag, but you know, very, very hopeful still that we're gonna come up with a win. And so we'll go over, Ellen will talk not so much about the election, a little bit, but a little bit more a general federal update on the packages and what's happening a little bit in the Senate and with the ACA and all of those good things. And then we'll turn it over to Charlie, and then we're gonna talk about our urgent state budget action items that are needed. And I know some of you have kind of joined some past webinars with Leo recently, and maybe even our advocacy trainings or some of my other webinars. And we've been kind of going over these same really critical issues, but now they've really risen up to be just incredibly critical issues for our community, especially with this second surge happening. So we'll walk you through some of those and then just spend the rest of the time on questions and sharing. And I'm gonna, I think, turn it right over to Ellen.
Thanks, Maura. It's good to be back. So Maura mentioned I was on maternity leave. I have a 4.5-month-old now, so Phoebe, and you might hear her in the background, so I apologize. She should be okay. But yeah, so we can talk about the election. If anybody, you know, this is, and Maura, are you covering admitting people?
I am.
Okay.
Yes, I'll keep clicking that.
All right. So, you know, this is obviously still happening. Election results are still coming in. If anybody has updates on their phone, they want to, you know, jump in and correct me, feel free. But yeah, I mean, it's a historical election, no matter what. I mean, it was record-breaking early voting. Over 100 million people voted early amid a pandemic, which is, you know, an incredible thing. In many states, the early ballots number of votes counted in 2016. So that's incredible. And Joe Biden received more votes than any president, any other candidate in history. So an incredible election. You know now, at least as of now in the House, the Democrats have kept control. So the seats are about 206 to 190. There's a necking of 6 seats for Republicans. However, Senator Markey, Massachusetts, retained his Senate seat, which was expected. But there are still districts that are, you know, still counting as in the Senate and the presidency. In Massachusetts, all representatives won their districts. So we have 9 Democrats in the House. As far as the Senate, it's still a deadlock for control, although it's looking more likely that the Republicans will remain in the majority. So far we have, at least the Associated Press has called 48 seats for the Democrats and 48 for Republicans, 4 still remaining. There's going to be a runoff election for sure, we know, in January for Georgia. So even if it's decided now, it could change in January as far as the majority. And And then for the presidency, still several, several outlets have called Arizona for Biden, but there's still states that are up in the air: Nevada, Pennsylvania, Georgia, and North Carolina. So there are some news outlets that have Biden at 264. He needs 6 more electoral votes to win, essentially, although we do know that President Trump he's filed lawsuits in Pennsylvania, Georgia, Michigan, and I believe will be in Nevada as well. So, things are not decided today as we had hoped they would be, but, we'll keep you updated as things progress. I'm sure most people are, checking on their own as well, but it was an incredible election. It was a huge turnout for the disability community in Massachusetts, allowing people to vote by mail, bring their ballots in, and it's been an incredible it's an incredible thing to do amid a pandemic. So what does this mean for our community? Obviously, the outcome of the election could impact critical programs like Social Security, Medicaid, Medicare. They're all hugely impacted by the election. And so we'll obviously be, keeping a close watch on what happens federally. But as far as the COVID-19 stimulus package, given the state of the Senate, I reached out to Nicole Jorwick, who's the policy director for the ARC of US, and basically given the status of the Senate most likely in this lame duck session up through January, nothing is going to happen as far as the COVID relief package, which is still mind-boggling to me because it shouldn't be a partisan issue. But there was legislation that passed in the House in May and in September that included our top asks, and the Senate never took up the larger package. They brought up smaller bills, but didn't address the larger package, and was waiting until what happened with the election, and then now that we're in most likely with this lame duck session, most likely nothing is going to happen with the COVID relief package. But we still encourage you to reach out to your senators. We know that Senator Markey and Senator Warren are huge champions for us, and they are, know our top asks and are rallying for us. But if you family members in other states, it doesn't hurt to continue to reach out to your members of Congress, or particularly your senators. But most likely nothing is going to happen with that. We are also closely watching a Supreme Court decision around the Affordable Care Act. It's the second time this has come up in the Supreme Court. Basically, the justices are going to be reviewing the constitutionality of the ACA's individual mandate. And its requirement that virtually all Americans need to buy health insurance. So we don't need to go into the details of the case, but it's something that's obviously very important to our community and could dismantle the ACA, and given the recent confirmation of the newest justice, Amy Coney Barrett, and then also Justice Kavanaugh in the seat in the Supreme Court, we don't know where this decision could fall, and it could have dramatic impact on our community. So we'll be watching it very closely, and we'll keep you updated on that situation. But we wanted to make you aware that the case is pending, and it's up on November 10th. So,
Ellen, can I ask?
Yeah.
I think one of our main concerns there is the issue of pre-existing conditions in the ACA.
Yeah, so that's right. So if it took away, basically it could, if they're deciding the constitutionality of the mandate, it could dismantle and, not require the ACA. So it would impact the ACA, basically, guarantees that if you have a pre-existing condition, you can still get insurance and you're not going to pay a ton of money or get rejected by insurance given your pre-existing condition. So that could be taken away. And so that obviously is a huge, there's many parts of the ACA that are benefiting our community, but that's a big one that would be, detrimental.
I was going to say, since we have kind of a small group, if people want to unmute and ask any questions on the federal stuff now.
Or if you've got updates, election updates.
And I can check, I don't see anything in the chat right now, but.
Ellen, is the COVID situation considered a pre-existing condition?
It could be, certainly. Yeah, I mean, we don't know the lasting impacts of COVID, but that's certainly something that could potentially be a pre-existing condition.
Okay.
Okay, so we can always get back to federal questions at the end, but why don't we keep moving if I can work my mouse. And we'll go to Charlie, and hopefully, I think you have a little bit better news for us.
I do. The current legislative session will end, I think, January the 5th. This year, about 15 members of the House decided that they were not going to run again. Some of those folks had been there a number of years. And so what had happened was that in the primary, there were 42 people running for one seat. And as it worked out, it ends up with now 15 new members of the House from really across the state.
Oops, I put 14, I'm sorry.
Well, you know what, I keep looking at this thing, and I went back and counted it again this morning. I'm sure if I count it again, I'll find another number. And
That's my fault.
No, that's okay. But there are 15 people who have not been in the legislature before. This past session, because people had resigned and gone on to other jobs, there were 3 House special elections and 2 in the Senate. So those people joined the legislature at midpoint at some points during the summer, but they also had to run again come the primary. As a result, again, with the results all in, there were 15 new members of the House and 2 new members of the Senate. What that really represents in the Senate, the magic number of Republicans is actually down to about 3 members of the 40-member seating in the House. And the same with the Senate. With the House, there's probably 32 or 33 members of the House that are Republicans. So it's pretty much a Democratic-controlled legislature. One of the things, though, it's been really good for us is some of the members on both parties have been really, really helpful. And we kind of call those people our champions, who we have gone to consistently. And in looking at the results of the election, none of those people that we would consider heavy lifters in terms of our efforts, they're back in the legislature, which makes it much, much easier. And it
was good to see, Charlie, that some of those were like landslides too.
Yeah, we have people, for example, I raised the issue with Josh Cutler. He did extremely well, and he was very helpful with legislation last session. And one of the Republicans that had a challenger, Senator O'Connor, down in the Weymouth area, he is back in the legislature, and he was very instrumental from the Nikki's Law, Dana's Law legislation. So I think part of it is what we will be doing is in the next week, we will be sending out individual letters to each of the new members, basically introducing ourselves and putting our agenda in front of them. Again, in the Senate, there are 2 brand new state senators coming on board. We'll do the same thing with them and sending that stuff to their house. And we did that 2 years ago, and it actually worked out well. And I think the ability to reach out to catch some of these people before the
Oh, we lost you, Charlie. Did you mute by accident? Where'd he go? Well, I think he was trying to say that we're getting a jump start before the session begins to get our agenda in front of the new people coming in. We call them freshmen. And then we really encourage you, if you have a new legislator that was elected, now's the time to reach out, pour your story to them, get to know their staff right away. I mean, it'll be like a month before they're all settled, but it's a really good time to connect to a new person and let them know that you're a constituent and that disability issues are really important to you. So that's our plan for January. We'll actually have what we call a new legislator orientation, and it'll most likely be virtual, of course, but we'll invite anyone who wants to come to that to come, and especially, obviously, if you are a constituent of a new legislator. So I think that was all that Charlie had on the election results, but when he comes back on, we can certainly have questions after I go through my slides. I want to get through today. I know it seems a little overwhelming when I put a lot on a slide, but I was looking at sort of the language of this slide and it really just jumped out at me. We need to restore, increase, address, allow, add. These are all words we typically reserve for one or two priorities in a legislative budget session. We don't typically ask for increases in more than a few line items because, you know, it's really hard to make a case for multiple priorities. Not that we haven't in the past, but there's no way around it right now. We desperately need each and every one of these issues to be addressed in this budget. So as you know, the budget was revised and came out, I think now 2 weeks ago from the governor, and mostly it was a maintenance budget in our DDS world, except for the day in employment line item, which took a pretty significant cut, I think 34 million. But the problem with the maintenance of our budget is that things have dramatically changed with COVID. And we know that families need more support than we knew in January when this budget came out initially. We've seen programs and individuals and families really suffering through COVID, and we need to address those situations. So in particular, if we don't address the DDS day and employment cut and look for an increase, oh, Charlie wants to come back in, I'll let you in. Then these programs may not survive. We're already seeing lots of staff cuts, programs really looking at closing down, many closing down, and this will have a horrible effect across the board on our community and families. So restoring that day in employment line, we really want to increase some family support, knowing that especially when COVID hit the first time in the first surge, families that needed to quarantine and needed to become 24/7 caregivers are going to need that kind of support again, potentially, or they need the support just in order to be home during hybrid learning, issues with transportation. So family caregivers are really needing our support. We also need to address PCA hours. We're hearing that they're not getting approvals, and if people actually have PCAs that they feel safe about and they're coming into the home, we need those hours to be increased and approved. We need to allow DDS and Mass Health to bill at pre-COVID utilization. And this is kind of the only way, and Mass Health is definitely an issue here, but this is the only way that they're going to stay afloat. We need to be able to bill not based on this decreased attendance. And then I know some of you know residential, that folks have been being served during the day while in their residence, yet not being paid. Staff is not covered for that. So providers are having to pay staff without being reimbursed. So super important that we address residential issues. The increase that came in this revised budget under the Chapter 257 rate increase is not effective until January, and this is a huge hit. So, and then I don't know if people on here are AFC providers or understand the AFC situation, but and Ellen's here, she can jump in. But one of the worst parts about this is they really haven't been stipend at all. So family support, at least initially, gave out some stipends, but AFC caregivers who took on pretty much 24/7 have not been stipend from the state. Ellen, do you want to jump in a little on the 12% increase, or?
No, I mean, I think it's pretty self-explanatory, I guess. Like this is something that, yeah, I think that even pre-COVID was an issue as far as caregiver stipends being able to, you know, maintain those rates for or the stipends for caregivers. It's been difficult to find AFC caregivers at the level of stipend. So they needed to address this anyway, but given COVID, things have gotten even worse. So
yeah, thank you. Right, and addressing PPE for that group entirely as well. So again, we definitely have more action that's needed on our COVID response. Did I spell that wrong? So we all know the first surge was really devastating, and that the second surge is really here. We're watching really closely hospitalizations, which luckily have not hugely increased. Of course, I think everybody's heard that the increase has really been clustering in the under 40 group. But when I looked yesterday at the dashboard, and I don't know if people are looking at that weekly, but there was some good news when you look at the actual spreadsheets and charts. It looks like our 7-day average is back to the 1.86 range, which it had shot up a little bit. So I like to look at hospitalizations, and I like to look at the 7-day average because that gives a little bit better idea than when they spike and peak and then drop. So as my last look as well, there were 75 client cases active in congregate care, and that includes the state operated homes and the private vendor operated or providers. And so that's we need to make sure that we are keeping a really close eye on our congregate care settings. And in that vein, we did reach out to DDS this end of last week and going into this week to give a heads up that, you know, we're concerned. We definitely see increased numbers in staff and in clients, and we want to stay on top of this. We want to get on top of this as fast as possible. So really keeping our eye on that. But for families, people are still through all of this trying to get back to work. We know our safety net is truly at risk given the federal mechanisms are not coming through for us right now. Another huge issue, you know, and I think we're going to hear more and more about this, is staffing for our group homes and day programs, especially with, you know, some of those staff are not able to, are really not able to work if they have childcare needs. And then many we're hearing are actually like really fearing the virus. You know, they've been through it once, they went through the first surge and they don't want to go through it again. And at this point in time, providers are really struggling with any kind of hazard pay. Most cannot do hazard pay, even if a staff person is working with a COVID positive client. So there's just a whole lot of work to be done, and we want our programs, our group homes and our day programs and our AFC programs to be able to do all of the infection control at the highest level that they can, but without that financial support, we really can't have those expectations. So it's really up to us to really push the advocacy in order to get the funding and the financial support for safety of our community. And I think, you know, now everybody's kind of turning to holiday concerns and how do we manage the holidays and bring our loved ones home and stay safe. So I think there'll be more guidance that comes out around that, and we'll share that as soon as we do get it. But I want to give everybody a chance to, weigh in here. I'll stop the share. And I think we got some late people joining us. And Charlie, you came back.
I did. My phone has a mind all of its own.
It's okay. I think I finished up for you, but do you have anything else?
I don't think so at this particular point. I think, again, I just mentioning the fact that the number of people that are currently had left the legislature, and part of our responsibility is to develop relationships with those new 15 people. And I think one of the things we always have to remember, I think there's all these new members in the House, they have constituents. Each one of those districts in the House side represents about 40,000 residents. So just if you take 40,000 residents, within that pool of people, there are people that are dealing with intellectual and developmental disabilities as well as autism. And so part of it is we become that mechanism to at least become a source for some of these people. And the same with the Senate districts, which represent about 160 residents per senator. That's, so part of it is, and we've been really pretty successful with some of these people who have been around a while. As we say, some of them are very dependable in terms of us getting stuff done with them.
So Charlie, the next step for everybody right now is, because I just went through the budget, is I'm just gonna, ask everybody to keep their heads up for what we call phone to action. It's called P2A. And we're gonna be asking you to reach out to your both House rep and senator and asking them to really take a stand on our issues, especially those that I outlined. And we will probably be asking some particular reps and senators to file amendments to the budget for us. So, we will definitely be putting out we wanted to wait until the election was over, and we were actually thinking today or tomorrow, but it may make more sense to put this out on Monday. I don't know, what do you think, Ellen?
Yeah, probably, I think.
Okay, so look for an alert on Monday. And anybody have any questions? I know we really threw a lot of stuff out there. Some of it you've heard and some of it you might not have. See, you can unmute or pop anything in the chat. Everybody's quiet, and hardly anyone has any video on today. So, thank you.
We've all got election fatigue.
I know. How's everybody feeling about the election?
I'm optimistic. I'm optimistic. I am. Yeah.
I wanted to say that I'm just very terrified about the ACO, and if that ends up getting cut apart and just with the pre-existing conditions, it's just terrifying. That's what's keeping me up at night. It's terrifying.
What's really great about Massachusetts is our strong legislator on healthcare. And I know that our Health Connector and our Mass Health programs are really something that our administration really strongly about coverage here in Massachusetts. But of course, throughout the country, we got to think about all those people who might be affected as well.
Yeah, and I think certainly if Biden does win, which it looks like he most likely will.
Say that again.
We're nonpartisan, but yeah, I mean, I think that he obviously is very passionate about Obamacare, or Biden care could be, so that would be a priority for him to reinstate and push that through. Although, again, the Senate may be still a Republican majority. So it is a big issue, and it's something that, that will be a huge concern for our community, and it is a top concern for the ARC-US and other disability organizations.
Does anybody have any information on the newly elected member of Congress, I think Austin Slots, who replaced Joe Kennedy?
Ellen, you got anything on that?
Wait, I'm sorry. What was the question?
The
I didn't hear you.
The member of Congress who replaced Joe Kennedy, I think it's in the 4th Congressional District. I think his name is Ashen Slots. He's I think a Newton
Right.
city councilor. Anybody have any
I-
info?
I don't really know that much about him, to be honest.
Yeah.
You know, I don't know. I mean,
Okay.
yeah, he's a Dem, but yeah, whether or not, yeah, I don't know. I think he's pretty moderate. I know he was in the military, but I have
Right.
don't have any details.
Well, I'm just going to say once again, we are really lucky to have the ARC of the United States. Their policy people are amazing, and we really take our lead federally from them and what to do. And like Ellen said earlier, even though our Congress people are fantastic on our issues, I think consistently reminding them of how important they are is really critical. So I wouldn't put past reaching out to them over and over around making sure the package that hopefully comes in January will include everything that we need. Let's see, we have something from far from over. Courts will be involved before it is decided, Paul says. This act made. Yeah.
You know, and we could, you know, very well get a good decision by the Supreme Court. I mean, I don't know. We don't know, but
Okay.
concerning.
Right, well, we definitely all have a lot on our plates right now, a lot to think about. And I think the one thing is for everybody to really stay safe, get through these holidays safely, and you know, stay in touch, because you're going to hear from us a lot. And thank you, Ellen, and thank you, Charlie. And
Thank you, Maura. Thank you, Ron.
Thank you.
Okay, we'll see everyone soon. Please take care.
Okay, thank you.
Thank you.